Hello, I am Dr. Donna Mendes, and this is a Society for Vascular Surgery briefing about the importance of follow-up in vascular care. I truly believe that it is paramount that we take full responsibility for our health. Knowing the mechanism of the disease that affects us will help us understand how we can better take care of ourselves. One of the easier disease entities to understand is our circulation. Arteries are like hoses with pumps, giving oxygenated blood to our organs and extremities, while veins are like garden hoses without a pressurized pump. Veins take the blood back to the heart and lungs so that it can be reoxygenated so that the entire process can start again. One can feel a pulse with an artery, but not with a vein. Many conditions cause less oxygenated blood to be received, and the most common mechanism is a narrowing of the vessel. So rather than 100% of the required blood getting there, a reduced amount is received. What causes that artery to become narrowed? That narrowing occurs because there is a layering on the inside of the vessel. There's a layering of calcium, cholesterol, and ultimately the formation of plaque. A minimal amount of narrowing of the vessel, all the way to complete blockage, can occur, and it usually causes symptoms, depending on the amount of the reduction of flow. An example is decreased flow going to the vessels in the leg, causing the patient to have pain when he or she walks. When the vessel is narrowed by 50%, the patient may walk 3 to 4 blocks before having pain. But if the blockage is suddenly 100%, the patient may have severe pain with just a few steps. All vascular patients have risks that make them susceptible to the layering of calcium and cholesterol and plaque on the inside of their vessels. The risks are diabetes, hypertension, a family history of poor circulation, high cholesterol, coronary artery disease, having had a stroke, being African American or Hispanic, cigarette smoking, past or present. Vascular patients are treated with stents, balloons, medicine, and exercise, and close follow-up with a treating physician. However, whatever caused the initial problem still lurks in the patient's gene makeup. Therefore, it's easy to see why once a vascular patient, always a vascular patient. One cannot change their family history or their ethnicity, and although the presenting symptom can be treated, the risks remain. Luckily, we have non-invasive tests that we offer all patients post-procedure so that we can see a problem early and prevent it from becoming a catastrophic problem when indeed it could have been a minor problem. If I treat your vessel now, none of those risks have been removed, and a similar condition can occur again. Therefore, you are a patient of mine now and forever. Any treatment that a vascular patient receives must be closely monitored with the variety of non-invasive tests we have available and by the constant monitoring of the clinical situation by the vascular specialists. By doing this close follow-up, we identify a minor problem before it becomes a major problem. In addition to close monitoring of the patient, the risks are aggressively treated. The recommendations of the vascular specialists after a stent, balloon, or atherectomy or cleaning out of the vessel include non-invasive tests that are performed regularly to monitor the patency of the treated vessel. If the blood pressure of the ankle drops, or if the scan of the vessel shows a narrowing, then an intervention occurs before a major problem occurs. I am now going to take the oxygenated blood back to the heart. It is very important for you to remember that the blood is returned by veins, and that veins do not have a pressurized pump to help get the blood back to the heart, except you and your calf. That's the only way it gets back. Yes, only when you walk and elevate your legs at night can the blood that has been pump pressurized to get to the legs get back to the heart. When we walk, the calf muscle pump moves the blood back. If we do not walk, there is a pooling of the blood, and clinically we develop the stigmata of chronic venous insufficiency. Our lower legs and proximal feet may become darker. The foot becomes swollen and puffy by day's end. Ways to treat this include walking to pump the blood back, wearing compression stockings if we have to sit for our jobs or if we have to stand for our jobs. Remember, we are not moving and the blood will pool in the leg. Remember I said that circulation can make sense. decrease the number of things that cause the vessel to be narrowed on the arterial side, and keep the blood moving on the venous side. Regardless, once one of the entities has occurred, remember to stay with your vascular specialist so that you can understand why your circulation is not moving as it should. We are what we eat: cholesterol, salt, plaque layering on the inside of the artery. And we are what we do: exercise, keep your weight down, and elevate your legs at night. We must learn that although the physician can help guide us and give excellent recommendations, the reasons why we have a certain disease needs to be well understood. It has to be understood by us so we can work together with our vascular specialist.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.